again, I'm going to be doing a abdominal assessment first and then a straight catheter demonstration. First thing I want to do is provide privacy to the patient, which I have done. Wash my hands. I'm going to identify the patient, make sure the patient tells me the correct date of birth and identification number. And I'm going to verify that in the wristband. Looks good. Next thing I want to do is expose the abdominal area of the patient, which is really small here. So I'll do my best. First thing I want to do is just kind of look back, observe for any distension of the stomach, any edema, swelling, anything like that. Stomach looks pretty good from this perspective. Next thing I want to do is auscultate. So when I'm auscultating, I'm going to start at the lowest part of the large intestine, move up, transverse, descending, all the way down to 4 different quadrants. I'll be listening for at least 30 seconds in each quadrant, and I'll just pretend that I'm listening. Going into all the different quadrants. If I didn't hear any vowel sounds in that time period, I would listen for at least 5 minutes in each quadrant for a total of 20 minutes. If there is absolutely no vowel sounds at all, just to make sure that nothing was working. Next thing I want to do is percuss the abdominal area. I'll be starting in the lower quadrant again, following the large intestine. Hard to do right here. And just going to be hearing for different sounds in different areas, especially over the upper left quadrant where the liver is. Next thing I want to do is lightly palpitate the abdominal area, and you don't want to go real deep because that could kind of upset the bowel. So palpitate each area again, following the large intestine. That was the rectum. Okay, and that is it. So I did my four different things with the abdominal assessment. I'm going to make sure that the patient is covered up. Document what I just found. Wash my hands. And that's everything for the abdominal assessment. Okay, so then I'm moving on to the straight catheter section, the male straight catheter. And so I'm going to enter the room, wash my hands again. Make sure that I have privacy for the patient. Make sure that identify the correct patient, and the patient tells me his date of birth, and make sure that he has the correct medical number. Next thing I want to do is expose the penis area.
No, that's that.
The first thing I want to do is just to get ready. I'm going to put on some gloves. Oh, and I also want to make sure that there is a medical order to do this, to do the straight catheter. Can't do it without that. So I have my basin here filled with some warm water and some soap. I'm just going to quickly clean the genital area before I do my straight catheter. Make sure that it's clean. Got my washcloth here. Dip it in my water. Clean around the penis. And to the top of it, around the bottom. Clean again. Using a different section. And dry off the penis. Okay. So clean that. Take off my gloves. Hand hygiene again. Then I'm ready to start with my straight cath. So I have my straight catheter kit here. This is a sterile procedure. So I'll just move this over. Got my garbage can here, close proximity, throw everything away. Clean this up. Got my gloves on the top. Put those to the side for now. So I've got my sterile sheet here, and I'm gonna put this underneath the patient's butt and underneath the penis. And it's not really gonna stay completely sterile, obviously, because I don't have sterile gloves on right now. I'm gonna have the patient pick up their butt, move it underneath, so that it stays clean. Okay. And I'm gonna kind of help out the patient here and open up the legs, so everything's exposed nicely. Next piece of equipment I have is another piece of cloth. I'm gonna put this over the penis. Alright, so then moving on, I'm gonna wash my hands in case I haven't done that. Open up my sterile gloves.
Unless they're taking
Yep. Garbage. I'm gonna here in the hand first. Sterile gloves are on, so everything inside of here is all sterile. I'm gonna kind of put this to the side here. Put my this top section to the side. There we go. And so I've got my iodine prepped. I'm gonna pour this all over my cotton gauze here. In real life, this would be black and be all over. So I exposed all that at the side. Alright, so this is all done. I'm going to throw this out, my iodine out. Next thing I want to do is clean up the penis. So I'm going to use one cotton gauze pad, clean around, throw it in the garbage, take my second one, clean around the penis again, garbage, and then I've got my last one. Penis, make sure everything is clean, and then throw that away. So the next thing I want to do is lubricate the penis, and then I'm going to also put a little bit on the side here, so I can lubricate the tip of the catheter as well. You can use this little basin here if there was no lidocaine on it, for the sidebar. And then in real life, I would also have a syringe that I could fill up with lubricant as well. So usually I would have a syringe, fill up the syringe with lubricant, and then lubricate inside the penis. And sometimes this also comes with lidocaine too, but we don't have either one of those. Alright, so I did that, lubrication. Next thing I want to do is take my catheter out, put my basin underneath the penis for the urine, and I have my specimen cup here waiting ready for me. So I'm gonna take the tip of the penis, insert the catheter. Till it doesn't go in anymore, and in real life I'd be getting discharged right now if I was all the way into the bladder. Alright, so I have some urine coming out. I'm gonna get my sterile specimen, fill that up. We got it over there. So my right hand is still sterile. Alright, so my patient has totally voided, so now I'm ready to take the catheter out. I'm gonna gently pull out. Okay, throw this away. Throw all my stuff away, throw my sterile gloves away. Wash my hands. I'm going to put on on some gloves and throw out everything else, except for my specimen here. This off. That way. Patient. Throw out all of my other equipment. I've got my gloves on so I can put the cap on my little specimen cup here. Throw all my other equipment away. This is all garbage. I'm gonna correctly label my specimen here with the patient's name, room number, date, time, doctor instructions, and probably medical record number. And then put my little sticker on the specimen container. Send this down to the lab or wherever the lab is in your hospital or healthcare area. Throw away my gloves. And hygiene again. Put the patient back down into a safe position and document everything that I just did, including how much was voided. And that's it.